Hello and welcome to the National Call on Coronavirus, Disasters, Housing, and Homelessness. I'm Sarah Stadian. I'm Vice President of Public Policy at the National Low-Income Housing Coalition. I'm filling in for our CEO, Diane Yantel, who wasn't able to make it to today's call. As a reminder, this call pulls together a real wide variety of participants from homeless shelter and service providers, housing providers and developers, housing advocacy organizations, low-income renters, and other people directly impacted by homelessness. We also have media on the call and congressional staff, so a really broad array of people with us today. And we have a really packed agenda, so I'm so thankful for our folks who are able to join us. On today's call, we're going to get an update from the Federal Housing Finance Agency about the steps they're taking to ensure that landlords are not violating the federal eviction moratorium that was issued by the Centers for Disease Control. There's really good evidence from Eviction Lab, which we've talked about on past calls, that have been ensuring that reductions have been reduced over the last several weeks. But still, we are seeing corporate landlords move forward with evictions despite the moratorium being in place. And the steps from the FHFA will help curb that, hopefully. We'll also get an update about a recent federal district court decision in Atlanta, Georgia, which denied a motion that was brought by landlords for a preliminary injunction against the CDC moratorium. We'll learn more about the court's explanation, including the fact that they make the argument for why the CDC does have the legal authority to issue the moratorium and why it doesn't violate the landlord's rights. This is a major victory for advocates, so I'm glad that we have a chance to focus on it on today's call, but it's certainly not the last word on the issue. And so we'll also be hearing from folks in Colorado who successfully got their governor to extend their statewide moratorium, which we hope other states will follow as well. We'll also hear from our partners at LeadingAge, Syracuse University, and TAC about the special needs of seniors and people with disabilities during the pandemic. And we'll get updates from the field in Washington, D.C. and in New Jersey before I give a Capitol Hill update later on. So let's go ahead and get started. Our first speaker is going to be Siobhan Kelly from the Federal Housing Finance Agency. Siobhan, thanks for joining.
Thank you. Thank you for having me. Good afternoon, everyone. Can you hear me?
Yeah, great.
Okay, good. Just making sure. Okay, so thank you to the National Low-Income Housing Coalition for having me. It's always a pleasure to be part of these discussions that put both affordable housing and tenant protections front and center. So I am excited to report that the Federal Housing Finance Agency recently released a brand new fact sheet that summarizes the protections that may apply to tenants living in an enterprise, that's Fannie Mae or Freddie Mac, backed rental properties during the COVID-19 national emergency. We at the agency, along with many of you on this call, believe that this information is critical to tenants and property owners who are trying to navigate through these unprecedented times. The fact sheet is currently up on FHFA's COVID-19 response page, but Sarah, perhaps you can also share the link with folks after this call. In addition, the fact sheet will be available on CFPB's renter protection webpage as well, again, in an attempt to really get the word out and share information. So overall, the fact sheet includes information that the enterprises about the enterprise's multifamily forbearance programs and applicable federal law, including the recent CDC eviction moratorium order. Any landlord with an enterprise-backed loan that fails to comply with the applicable law may be subject to remedies under the loan documents, which could include moving the loan into a technical default and revocation of the forbearance, if applicable. Now, specific to the CDC order, FHFA's fact sheet provides information about the order, as well as links to the actual CDC order and to the tenant declaration form. So essentially, information that we received from market participants and housing advocates, including the National Low-Income Housing Coalition, has shown that many tenants and property owners are simply unaware of the tenant protections included in the CDC order. In addition, we understand that many tenants were very unfamiliar with the declaration form. So our hope is that with this fact sheet from the Federal Housing Finance Agency, it will help increase awareness of those protections, particularly among tenants that are living in enterprise-backed properties. Now, within this fact sheet, We've also included tenant protection information that applies to residents of enterprise-backed multifamily properties that are currently in forbearance. And it is important for tenants to know that they have certain rights during forbearance, including protection from eviction and late fees. Additionally, when the loan moves out of forbearance and into the repayment stage, landlords are not permitted to require past due rent to be repaid in a lump sum. And this was done in an effort to encourage repayment plans over time. So if a landlord decides to move forward with an eviction filing, they also must provide the tenant at least 30 days notice. FHFA requires landlords to inform tenants of their rights under the forbearance agreement. The fact sheet also includes links to Fannie Mae and Freddie Mac's multifamily loan lookup tools that tenants can use to determine if they are living in an enterprise-backed property. And many of you will remember that the lookup tools were also something that FHFA directed the enterprises to create in order to really better educate tenants on the property that they live in. It is FHFA's goal that this new fact sheet will provide information that is useful to both tenants and owners during this very uncertain time. I know I speak on behalf of the Office of the Director when I say we truly appreciate all the counsel that the National Low-Income Housing Coalition has provided in recent months, and we look forward to continuing to work closely moving forward. We believe that this is a step in the right direction to better educate tenants and owners, and we will continue to monitor data as well as any new or evolving challenges facing tenants, borrowers, and the mortgage market as a result of the COVID-19 national emergency, and we will update our policies accordingly. So thank you for your time today, and please take some time to check out our fact sheet. Thank you.
Thanks, Siobhan, so much. I do have a quick question. So we shared a link to the fact sheet in the chat box for folks to have. We'll also share a link to it. We will also share a link to it afterwards in our follow-up email. But I did want to ask you a question. So one of the biggest changes between this fact sheet and what FHFA had done before is noting that any landlord that has a FHFA-backed loan could be moved into technical default if they were to violate the CDC order. I'm wondering if you can give us a little bit more details about what that would mean in terms of consequences for those landlords.
Yeah, so it's a little bit, unfortunately, I don't have our legal counsel on the phone, but it's essentially kind of what you said. It's a default that could potentially happen. And again, a lot of this, I think, would be on a case-by-case basis. I think the thing that we're really trying to make sure that landlords are aware of are that there are repercussions to not following the order. So I'm happy to provide, maybe, Sarah, I can shoot you some more information kind of once I follow up with our legal. I just want to make sure that we're getting you the right information.
Yeah, absolutely. Thank you so much. And if you have time for a question or two more, I'd love to be able to ask you a couple, if that's okay with you.
Sure, go ahead.
Yeah, so one of the things that when we spoke with Director Calabria, he had mentioned that if we hear of tenants whose landlords are violating the order, that we could escalate those issues to his office, and that's something we're glad to do. So this is an open invitation to folks on the call that if you're seeing this happen in your communities, you can reach out to us and we can help escalate those to FHFA. But is there a process for which renters could report this information to FHFA if their landlord is moving forward?
So we don't have, because we're not an enforcement agency, and we're not consumer facing, we don't have a specific process. But to your point, I think, we would encourage renters individually. They can also reach out to Freddie Mac or Fannie Mae. We've seen, a handful of different instances where that has potentially been the case. But renters can either reach out to them, or again, they can reach out to the agency, and we can pass that information on to the enterprises. But because we're not a consumer-facing agency, we don't have any specific process or, a form that you can go fill out online or anything like that at this point.
Mm-hmm. Yeah, thanks so much, Siobhan. And one more question I see from Lisa, who's asking, because there's additional protections that are in place for renters in properties that are receiving forbearance, how would tenants know whether or not their landlord is receiving forbearance from y'all?
Yeah, so we're requesting that the landlords let the tenants know. We don't have anything specific. So if you go on to the multifamily, the lookup tools, you're just finding out if the property is a Freddie Mac or Fannie Mae property. But we're encouraging the landlords to let tenants know once they are entering into forbearance.
Great, thank you so much, Fawn. I don't see any other questions right now in the Q&A box for you or in the chat box. So thank you so much for joining. We really appreciate our partnership with you and the work you guys are doing to help protect renters.
No problem. Thank you. And again, like I said, we really appreciate all of the feedback that we've gotten from you. It really helped us when we were trying to come up with this fact sheet. So again, appreciate all of the collaboration.
Absolutely. Thank you so much. So now we're going to shift gears a little bit to talk about some of the specific challenges that have been facing seniors and people with disabilities during the pandemic, as well as housing providers that serve those populations. So first we'll turn to Linda Couch from LeadingAge, who will speak about some challenges facing senior housing providers. Linda?
Hey, Sarah. So a couple of things. LeadingAge represents the majority of HUD-assisted senior housing providers. So we've been doing a ton of work, obviously, with our members around COVID. There are about 2.5 million older adults across the federal housing programs who get some form of housing assistance, including more than 1.5 million older adults in HUD-assisted programs. And we know that 80% of all COVID deaths are among people who are 65 plus. And so a real focus on this senior population makes a lot of sense. We also know that COVID aside, older adults with housing assistance are more likely than their unassisted peers to need help with activities of daily living, to have chronic health conditions, and to need help with personal care or some other services that necessitate service providers coming into their homes or them going and getting help from service providers. So in October, we surveyed our affordable senior housing providers. We're going to do this survey quarterly, but we wanted to share today a few of our key findings. So on the first chart, the slide with the first chart, one of the key findings is that of the respondents, 60% said that they are aware of confirmed COVID-19 cases in some or in most of their affordable senior housing communities. This is just kind of a baseline saying that, it's not a nursing home, it's not a meatpacking facility, it's not a jail, but senior affordable housing is congregate living where every resident has a set of service providers that are unique to them. And even though the buildings closed down for all intents and purposes for visitors and non-essential services, these are really open buildings in a lot of ways because they're set up to allow residents to age in community. So you'll see in this chart that 38% of our respondents are aware of positive cases in some of their communities, and another 40 in, another 22 in most of their communities. We've been really urging more testing availability for residents, so mobile voluntary testing at affordable senior housing communities. A lot of residents have difficulty reaching testing sites safely. Modes of transportation that they might otherwise take advantage of, like a bus or public transit, have not been running, and so access to testing sites has really shrunk. We do have a lot of members who have successfully partnered to bring testing on site for residents who are interested in it with state and local health departments or with federally qualified health centers. But just highlighting the fact that, there are a lot of positive cases in these communities, we hope will bring the needed attention to them. Another key finding on the next slide, we asked providers, what do you see as your top challenge over the next 3 months? And they could pick from this long list of things. They could pick as many as they wanted. And 84% of them chose resident social isolation and access to services. As I said, these communities really buckled down and restricted visitor access to all but essential personnel. The community spaces were closed, the dining rooms were closed, the libraries, the laundry facilities all had to change how they were operating, getting mail. Everything became a lot more complicated and a lot more socially isolating. Most residents don't have Wi-Fi in their units. Buildings, it's unusual that a building itself pays for the Wi-Fi in the unit. That's not something HUD typically allows. Only half of HUD senior buildings have a service coordinator to even help them with getting access to things like telehealth or programming or what it is that they need. And so most of our members, the vast majority of our members, really highlighted resident social isolation and access to services as a top challenge. We're really worried about winter coming. Now, with the time change, we didn't have to go through the holidays last year. With COVID, we're going to have to go through Thanksgiving and the winter holidays. And I tell you, our members report again and again and again mental health challenges and depression. And it's not just residents, it's staff too. Staff, I would say on the whole, are exhausted. On to the next slide. We asked about maintenance backlogs. We're really interested in how far behind maintenance work orders are. And you'll see here that 44% of the respondents report maintenance backlogs of 1 to 6 months, but 55% said that they don't have any maintenance backlogs at all, which is good news. We'll be doing the survey again in January, so we'll see what the changes are. But right now, I don't think this is a surprise to us, but of course, a lot of all non-emergency work orders were put on hold, and many are now back on track and receiving emergency and non-emergency work orders, and they're in the process of playing catch up with that right now. And then finally, the last one is around financial cost strain of COVID on providers. The CARES Act in March provided some funds for senior housing providers, but those were only just distributed at the beginning of October, really right when we were doing the survey. And in the survey, you'll see that 69%, and this is the last chart in our slides, 69% of providers said that they would describe themselves as cost burdened. And our provider members are spending a ton of money on things that they never budgeted for: cleaning and disinfecting, staffing, services, things like meals and laundry, increased insurance premiums, and again, Wi-Fi. Wi-Fi is a big nut to crack, both for primarily for residents who don't have it. So again, we'll do the survey again in January. We're interested to see how things change. But those are some of the findings, Sarah, of what we found in our survey of senior housing providers.
Great, thank you so much, Linda. I had a couple of questions for you. One, could you remind us who were the respondents to the survey? What types of entities are they?
Sure. They are, I would say probably 80% of them are HUD or HUD assisted providers. So nonprofits who primarily, I would say, most of them are nonprofits who run programs through the Section 202 Housing for the Elderly program, Section 8 project-based rental assistance, some tax credit, and probably some public housing agencies in there.
Mm-hmm. And when you surveyed them, did you give them a definition of what it meant to be cost burdened or severely cost burdened from the housing provider perspective?
No, we didn't. We let them define that on their own, and no, we didn't.
Okay. I'm seeing some questions about getting access to your PowerPoint, and we'll be sharing that with the group afterwards. My only other question for you is there any resources that were in the HEROES Act that passed the House that would address some of the issues of your members here?
Yeah, definitely. So there in the HEROES Act, there were a lot more resources just for COVID relief. HUD multifamily members can't use their CARES money to pay for meals, and that's a huge food access continues to be a huge issue. Another thing that was in the HEROES Act that we are really hoping to achieve as soon as possible is $300 million for service coordinators. It's really unconscionable that half of HUD-assisted senior housing communities and almost no tax credit senior buildings have a service coordinator, when we know the value of a service coordinator to connecting residents to the services and benefits that they're eligible for and that they need. Something that wasn't in HEROES that had been introduced in the House by Chairperson Waters was an additional provision that would have gotten Wi-Fi, paid for Wi-Fi installation and service fees in resident apartments, something that currently HUD's Office of Housing and Multifamily does not see as an eligible expense during COVID or during non-COVID times. So, getting Wi-Fi in has been introduced in the House, and that's another thing we'd like to see.
Thanks, Linda. I see another question about whether or not are there landlords doing wellness visits regularly for residents?
Oh, absolutely. And so, there was a GAO study a couple years back that looked at, so you've got let's say half or a little more than half have a service coordinator. Those service coordinators are all about checking in, right? But with COVID, how you check in is different. So it might start out with a phone call. If there's some sort of video screen, it might be telehealth. It might be a meeting in the lobby, sort of a socially distanced one-on-one thing. And so the service coordinators are all about wellness checks, when the resident is interested and wants to. It's independent living, it's all voluntary. But the GAO also found that when there's not a service coordinator on site, the owners and management of the building are figuring out what they can do to help meet residents' needs so they can age in community. And so we've really been encouraging partnerships with federally qualified health centers, getting as many options available to see which ones click with residents that they're going to want to connect with.
Great, thanks so much, Linda. If we have further questions, we can share them with you after the call and to put answers in our update that goes out at the end of the week. But I appreciate, or at the end of the day, sorry. But I appreciate you joining our call, and thanks for sharing this information. Maybe in January, when you have the results from your news survey, you could come back and share that with us too.
Terrific, thanks.
Great, thanks. We'll now turn to Scott Landis from Syracuse University, who's going to share a little bit about some of the challenges facing people with disabilities. Scott?
Yeah, do you have me?
Yes, go ahead.
Great. Thanks for the time. Thanks for inviting me today. I'm a sociologist at Syracuse University, and I'm focusing most of my attention right now on COVID-related outcomes for people with intellectual and developmental disabilities. So these are folks who have disabilities diagnosed before age 18 that affect their development across the life course, usually affect adaptive skills. For many people, it also affects their cognitive abilities. So if you're not familiar with the population, folks with Down syndrome, some people with cerebral palsy, Prader-Willi syndrome, also just some general intellectual disabilities that reduce cognition. We were concerned going into the pandemic because of our prior research showing that this group has higher prevalence of pneumonias, respiratory related diseases, long-term infections like pneumonitis, that at the beginning the CDC was saying were risk factors for more severe COVID outcomes. And so the other thing that really concerned us going in is that we know that estimates are between 17 and 20% of this population live in congregate settings. And in the United States, what that looks like is typically a residential group home, which can have between 6 and 15 residents. And so usually shared bedrooms, shared living space, shared bathrooms, and staff coming in and out on 8-hour shifts. So if you're in one of these residential group homes, you might have 10, 12 other people with disability living with you, but also have 25 to 30 staff members coming in to the home on a regular basis. And staff are usually, as you probably know, low paid, low wage, and so having to work a couple of jobs just to survive. These are Medicaid waiver homes typically. So states and feds match dollars to supply the residents, the finances for the residents. The residents typically have to spend down before they can even get a Medicaid waiver. So most will qualify as being low income, and all their healthcare services are through Medicaid. There's very little data being reported on this population, which is one of my biggest concern. Currently, 12 states are reporting some types of information on how folks are faring, but it's haphazard. There's no standardization across the US. Although CMS funds the waivers for this population, they've so far refused to ask states to report the data. So we were able to collaborate with a group in New York State of providers that they provide care for about half of the residential group home providers and the group homes in the state. And we've been tracking COVID data with NIDA, New York Disability Advocates, from the beginning of the pandemic through now. We continue to do so. What we have showed in our reports is, at least for those in New York State living in these residential group homes, they're 4 times more likely to contract COVID. And when they do contract COVID, they're 2 to 3 times more likely to die from it. We think this is probably from a few different things, very little to do with disability itself, a lot to do with pre-existing conditions, but more than anything, our feeling is because of the congregate settings. I think it's important to realize that the US is somewhat unique in the way that we provide services for this population. A lot of more progressive European countries fund services such that people can live on their own or with minimal staff support, but rarely do you have more than one other roommate. Whereas here, we have successfully over the years reduced budgets in states enough that they're more or less are creating many institutions in these residential, quote unquote, residential settings. So our suspicion after this first report was that, okay, this is really all about the congregate setting. We've got more evidence. We've got a paper that just went out for review now, where we have California data. And the good thing about the California data is that they have reported COVID outcomes among folks with intellectual and developmental disability by place of residence. And what we're showing there is folks with intellectual and developmental disability who are living either in their own home or in a family home have very similar case fatality rates from COVID-19 to the general population. There's very little difference at all. But people living in any type of congregate setting, a group home, with 4 to 15 or sometimes more than 15 people, their case fatality rates are consistently 2 to 3 to maybe even 4 times higher if you have folks receiving more types of nursing care. So the big concern that we have, housing related for this population, is that the way that we've structured the system of supports in this country really is quite harmful to folks with intellectual and developmental disability during the pandemic. Things that we think could possibly be done differently, and they are in other countries. And what we're seeing in other countries is that the case fatality rate is lower for folks with intellectual and developmental disability. Obviously, you can't prove that that's because of the way that the housing structure is set up, but that's our suspicion. So I'll stop there if there are any questions. Oh, the only other thing that I'll highlight is this recently got some attention. Senators Warren and Murray and Hassan wrote to CMS. Well, actually, they addressed it to Seema Verma with CMS, asking CMS to require states to report COVID-related outcomes for folks with intellectual and developmental disability. To date, their only response is, well, we don't collect this data. But the whole push from the folks in the Senate was to say, well, you should. You're helping fund these services, and we need to at least know what's going on across the U.S. for this vulnerable population.
Thanks so much, Troy. Yeah, that's just a heartbreaking situation, and something very similar to what I think many of us have been seeing in congregate shelters across the U.S., where because of the congregate settings, people are at a higher risk of contracting coronavirus and from passing away from it. And I'm wondering if you're seeing a similar conversation happening in your field, where maybe there's more of an emphasis on shifting away from congregate supportive housing or congregate settings for people with disabilities.
I think you have on the provider and the family and the individual with disability level advocacy for that model. What states are saying is we're cutting your budgets, and the way that we want to make this work is you're going to put more people per home. So there's a real disconnect between what advocates and individuals with disability are hoping for and what the reality was going to be with this. I mean, I know in New York State, they just cut the budgets by 25% across the board. And the providers have said, we can't continue to do this. And they said, well, then you close and let somebody else pick up your residents and they can combine into larger settings. So the fear that we have in this field is that not just from the pandemic, but the post-economic downturn that we're going to have might lead to what we would think is more institutional models within the community for this population. So yes, I think that's what we want. I don't see that happening, unfortunately.
Mm-hmm. I see a lot of comments here about people voicing concern about moving backwards towards an institutional framework, and also folks who are really interested in you sharing, if you can, through our chat box, links to some of the reports that you mentioned so that people can read up more about that.
I'll put the links to our papers, and also put the link to this recent Senate letter that went out October 14, because, I mean, if you want to write a letter to any of these senators of support, it'd probably be helpful.
That sounds great. Thanks so much for joining, Scott.
Thank you all for letting me do so.
We're now going to turn to Lisa Sloan from the Technical Assistance Collaborative, who is going to share more about some of the challenges facing people with disabilities.
Hey, everybody.
Lisa?
Hi, everybody. Thanks for inviting me to join and to build on what Scott has spoken about. And if you're checking the chat box, you can look a little bit at what Molly Bergdorf is saying. I think the challenges that Scott is talking about are real, but there are also some awesome tools, specifically a Supreme Court case called Olmstead that really can be leveraged to help keep people with disabilities in the community, help them move into the community. So Scott and I didn't coordinate. I'm gonna flesh out a little bit some of what he's talking about across some other disabilities and kind of give some specific numbers. So I'll try to move through the things that are duplicative pretty quickly. Next slide, please. Thanks. So here's a slide that kind of fleshes out what he's talking about, which is where do people with disabilities live? So people with intellectual or developmental disabilities, the population that Scott was talking about, here's a slide about where some of those folks live. So people who do not live in their family home, over 500,000 folks live in relatively small but congregated facilities, 6 or fewer. And part of the reason that's been happening is at one point, CMS, the same agency that Scott was just talking about, the senator writing to and being non-responsive, CMS has actually previously been pushing states to move towards a smaller, if people were going to be in group homes, that they had to be more home-like and smaller settings, which in the end translates to safer, right? It means you're less likely to have a roommate. It means a better staff ratio. It'll mean that people will be helped to be more socially distanced and engage in the activities that are necessary to stay safe. Nonetheless, over 120,000 people you can see in this chart with intellectual and developmental disabilities live in larger settings, many of whom are in settings with 16 or more people. These are really very institutional settings. You're more likely to have a roommate. There's going to be a more difficult staff ratio, especially probably during COVID. So less socially distancing. I'm sorry, I'm being distracted by the chat box. I apologize. So next slide, please. A research group called Mathematica, as you can see here, found that for non-elderly people with disabilities, there are about 190,000 people with physical disabilities, over 77,000 people with intellectual or developmental disabilities, over 34,000 people with psychiatric disabilities living in these kind of larger institutional settings, all of whom are going to be significantly at risk. We also know that that there are a lot of people with disabilities who are homeless. And for example, the most recent HUD data shows that there are over 100,000 or close to 100,000 people who are chronically homeless, meaning people who are homeless who have a disabling condition, some of whom, a third of whom are in sheltered, the rest of whom are unsheltered. So clearly inherently an unsafe situation. That said, since the CARES Act funds have been coming into the community, those funds, a big portion of those funds, which the coalition really advocated for, have been focusing on keeping people in shelters and on the streets safe. They've been funding ways to decompress shelters, helping people live in FEMA-funded hotels, helping people move into the community using the rapid rehousing model. So we can really see that those funds have been helping many people with disabilities in a certain situation, but not necessarily in people who have disabilities who are in congregate settings that are not shelter settings. Next slide, please. So we've all heard the very distressing data about people in nursing facilities. 20%, the Kaiser Family Foundation estimates that about 20% of the 1.4 million people who are nursing facility residents are under age 65. The most recent data from the Kaiser Family Foundation shows that long-term care facilities, nursing facilities, they account for 8% of all coronavirus cases, but more than 40% of all deaths. These are clearly really incredibly unsafe places for people to be. And there are a lot of both seniors, as Linda was talking about, and younger people with disabilities who potentially could live in other situations. I wanted to point out that in the same way that that CMS does not require nursing facilities to report on disabilities, they have not historically required reporting on race. But the Kaiser Family Foundation has found a way to look at that data, and they indicate that residents in their data shows that residents in facilities that serve a relatively large share of Black and Hispanic residents have been disproportionately impacted by coronavirus. So there's sort of, unfortunately, an amplified effect there. Next slide, please. So the data shows that lots of people with disabilities live in these congregate settings, people with a variety of disabilities. But the data also shows that people with disabilities really prefer not to live in those settings when they're offered a choice. They would prefer to live in the community in their own apartment like many other people. Maybe with a roommate, maybe not, but in their own apartment with their own room with a lot of control over their home and their daily living. So in this slide, I wanted to highlight a program called the Money Follows the Person program, which is a program that the federal government had funded for quite a while. Then Congress didn't fund, and now they've refunded very recently again. And this is a program that specifically identifies people with disabilities in nursing facilities, seniors and younger people, and whoever's interested will provide assistance helping them transition back to the community. In general, the data shows that seniors have had a home to go back to, whether that was an adult child's home or their own home. But many people with younger people with disabilities did not have that opportunity and moved into their own apartment, a new apartment. So here, okay, real quick. So you can see, but the problem is that you can't decongregate or transition without affordable, accessible housing and community-based support services. Next slide, please. So some of the specific challenges that, besides just the congregate nature of these facilities, the lack of PPE in nursing facilities, group homes, or other congregate settings has really made it challenging to keep people safe who are living there. And The things that have made it difficult for people who got stuck in nursing facilities at the beginning of COVID and couldn't get out include lockdowns in nursing facilities. The housing application process has really slowed. I think Linda's data where she showed a 42% vacancy rate, or 42% said they had vacancy issues. The application process has been difficult during COVID. While Medicaid funded services have expanded, home and community-based service slots, the slots that Scott was talking about earlier that fund those long-term support services, were not expanded in many states. So people who need those types of services did not necessarily have access to them. Next slide, please. So I'll just say two things about this. One is, like Linda, the HEROES Act would make a huge difference. All of the items, particularly the rental assistance, the ESG funds, the housing choice vouchers, and it's really important to do it now. But the disability community has also had difficulty helping people decongregate in the kinds of settings we're talking to about using the funding sources that have been allocated. And this is something that has been a challenge to address. So while there's a lot of support for these programs, we are hoping to find a way to ensure that they also address the needs of people with disabilities in these other settings. One more slide. Hey, there's some good news. What can you do now to keep people safe? First of all, a couple of weeks ago, HUD put out a notice to every housing authority across the country that has the housing choice voucher program that they had money that was available not through a competition, but just through filling an easy one-page form that can provide somewhere between 40 and 75 vouchers per housing authority, specifically for younger people with disabilities between the ages of 18 and 62. They could be people coming from nursing homes. They could be people coming through shelter, coming off the streets. You need to make sure your housing authority is asking for those funds. I know it's crazy. Who could imagine that they wouldn't want to expand their program? But I think we'd be surprised. They might need a nudge. They can't necessarily figure out how to run a program for these populations without help from community organizations like yourselves. So that's important. The other thing you might want to try to take advantage of is this Money Follows the Person program. There was an expansion of that. Funds were made available to 33 states, a lot of money. And so there may be opportunities in your community for helping people with disabilities transition from nursing facilities and potentially match that with the mainstream voucher program. Okay, thanks, Sarah, back to you.
Thank you so much, Lisa. I see a lot of good conversation happening in the chat box. Folks are asking for a copy of these slides, and we will provide them after the call through our disaster update. And I just want to thank you so much for joining to share this information. It's really important that when we're talking about decongesting shelters, that we're also making sure resources are available for other congregate settings too. So I appreciate you joining on the line.
Thanks for having us.
Absolutely. We're going to move next to hear more about the Atlanta court case in which the judge overturned or denied a preliminary injunction against the CDC moratorium. So I'm going to turn it over to Kate Waltz, who can get from the National Housing Law Project, who can give us an update there. Kate?
Thanks, Sarah. Actually, as a start, there have been 4 federal cases thus far challenging the CDC's September order on evictions. And so last week, the first decision was issued in one of those cases. So last Thursday, a federal district court in Atlanta in a case called Brown versus Azar denied a motion for preliminary injunction of that CDC order. The case had been brought by individual landlords and the National Apartment Association. In this case, the court made several findings that I think are helpful to housing advocates and efforts to secure the HEROES Act. First, the court found that Congress gave the Secretary of Health and Human Services broad power to issue regulations necessary to prevent the introduction, transmission, or spread of communicable diseases. and that HHS delegated that authority to the CDC. Because the order is necessary to control the COVID-19 pandemic, the CDC was authorized to issue it. The court also found that the CDC's response of a temporary eviction moratorium was reasonably necessary during an unprecedented global health pandemic, where without it, people will either be homeless or forced into shared or congregate settings, which, as we know, will increase transmission rates. The court also said specifically that it was not their job to render a judgment that the CDC should have taken other public measures to protect the public health and rates of transmission. The court is essentially saying they are deferring to the CDC on this issue about the best way to protect the public health. The court also noted that the evidence suggested that in the absence of the eviction moratorium, 30 to 40 million Americans could be at risk of eviction on a scale that would be unprecedented in modern times, and specifically cited to the Eviction Lab scorecard. Unfortunately, the court's order also relies upon the CDC FAQ from October 12th. In that FAQ, the CDC is stating that it does not bar the actual issuance of a termination notice or the eviction filing, or even an eviction case going to judgment. It is only delaying the actual eviction. So the court is relying upon this in part as its findings, that it is not denying those landlords permanent access to the courts. NHLP disagrees with the CDC FAQ, believes it is not subject to deference, as is the initial order from September, because the FAQ is largely looking at and trying to interpret how evictions work, which is not within its subject area. It is not an expert on housing or eviction courts. And from the FAQ, it appears to not understand how evictions work. And the result of the FAQ will be that there's likely a huge eviction cliff coming after December 31st, unless that order is extended and Congress is able to act quickly thereafter with larger assistance. However, the court does correctly note that the CDC order permits landlords to still collect fees, interest, penalties, and back rent, and that tenants still have to try to pay their rent. There is some helpful language that could indicate that the original CDC order, as interpreted to prevent even the initiation of evictions, would be upheld. The court notes that there were 2 state moratoriums on evictions that were challenged and were upheld by the courts. And in both of those state moratoriums, they completely barred the initiation of eviction proceedings. It also notes that the tenants may be able to seek government assistance, and specifically cites to the CARES Act, which again, I think speaks to the importance of future rent relief from Congress. And so, as I noted at the outset, there is other pending litigation against the CDC orders, so this situation is continuing to develop. There was a case filed in Tennessee brought by a group of landlords challenging the order. There are groups seeking to intervene in that case, and NHLP has filed an amicus in that case. There was also a case brought in Missouri, not challenging the order, but challenging how that order was being implemented in Kansas City, Missouri. And that case was brought by the ACLU and legal aid offices there on behalf of a group of tenants and a tenants union. They are trying to argue that that order does in fact mean you cannot initiate the eviction case, including by issuing the initial termination notice. And then finally, there was last week a new case brought in Ohio. At this point, no preliminary injunction motion has been filed. There was an original case brought in Ohio, which was dismissed after the CDC issued its FAQ. And I'm seeing a note in the chat. I'm happy to provide a copy of the court decision and our amicus briefs.
Yeah, thanks so much, Kate. I'm wondering, what do you think? When I read the court decision, I was surprised at how far the court went in laying out just how much authority the CDC has to issue this moratorium. It didn't seem like it was necessary to go that far. And I'm wondering, what do you think the effect of this decision will be on maybe other landlord groups that plan to bring or want to bring lawsuits?
I don't know how much effect it will have on other landlords seeking to bring lawsuits. It appears they are trying to pursue a multi-state effort, but I think it's a very helpful opinion for other courts who are being asked to whether or not to grant a preliminary injunction against the CDC order. The judge was a Trump appointee. The court laid out why there should be deference to HHS and the CDC to deal with a global health pandemic, and that saw that it was a reasonable interpretation of their power and reasonably necessary to protect the public health. So I think that type of language could go a long way in helping other courts come to a similar conclusion. And I'll say too that all of this is consistent, and the court notes this in the opinion, with the some of the other cases where state eviction moratoriums have been challenged, or where the closure of a church or gyms have been challenged. And courts have similarly found that this was within the power of a federal agency to should protect the public health.
Great, thank you so much. And we're going to keep moving on with our agenda, but Kate, I encourage you if you could share a link to the order or a link to your amicus brief in the chat box for folks to check out. And just to mention that the National Open Housing Coalition also filed an amicus brief in the Missouri case, and we will share that link again in our disaster update when it goes out later this evening. So thank you so much, Kate. Appreciate it.
Thank you.
And now we'll turn to Jenny Rogers from Enterprise Community Partners in Colorado, who had a successful effort to get their governor to extend their eviction moratorium. Jenny?
Hi everyone. Thanks for having me here today to talk about what's been going on in Colorado to reduce evictions due to COVID. I've got a couple slides to give some background on what we've been working on here. If you want to go to the first one. So with some background, since March, our governor has issued a series of 30-day eviction orders that included a moratorium, prohibition on charging late fees, extending the time period to cure back rent, and to fund eviction prevention. However, many of these protections that were included in these executive orders expired during the summer, and advocates were really frustrated that Colorado had not taken as many steps to prevent eviction as other states. In August, our Governor Polis appointed a 10-person special eviction prevention task force with representatives from across the state, and with representatives that had many different perspectives and backgrounds, including those from our statewide apartment association. And I was one of these appointees. However, one of the groups missing were the advocates on the ground, those who work directly with tenants, those providing legal assistance and navigation to residents. And so Enterprise and our partners quickly realized that my position on the task force was going to need to represent a broad coalition of partners, and that we needed to get organized with a list of outcomes that we wanted from this very short 30-day long task force process. If you go to the next slide. So to do that, we and our partners put together a policy platform that we sent to task force members ahead of our meetings, and which was organized into these 5 buckets of activity that you see on this slide. The task force met weekly through September, and we were directed to provide recommendations to the governor the first week of October. So this was a really quick process. A group of partners met between meetings to strategize for each of the next meetings, reached out to staff at the governor's office between meetings, and worked with others on advocacy outside of this task force during the month of September. We really worked hard to push for meaningful recommendations. And I have to just say again that this was really a collaborative effort. We had partners like the Colorado Coalition for the Homeless, the Colorado Center for Law and Policy, the COVID Eviction Defense Project, and others. working together to make sure that we just kept pushing on this task force for really meaningful steps, as I said, in these 5 buckets. One of the things that we've been doing for the last 5 years is to advance a tenant protection platform at the state level. Colorado is not known for our tenant protections. We haven't necessarily had strong tenant protections in the past, and we've been working over the years to pass legislation to bolster them, which meant that during COVID, our tenants have been more vulnerable than those in states with stronger tenant protections. We also realized as we were putting together this platform that we really needed to advocate for more resources targeted to landlords, and that we needed to make sure that they could stay afloat during the pandemic as well. We also wanted to look out into the next year and beyond, deal with the long-term effects of the pandemic on renters, and make sure that we understood the impacts on these vulnerable tenants in our communities. So as you can see in the 5th bucket, we have recommendations that were to track evictions and resource allocation to inform equitable emergency response interventions. If you can go to the next slide. Our task force worked through the month of September, came up with a final report the first week of October that made 14 recommendations to the governor. They were categorized or put into buckets for the short-term interventions, midterm, and long-term. And you can see a few of them on this slide. We pushed for a state moratorium that mirrors the federal order. For the very reason that Kate was talking about, we were worried that the CDC order may be struck down. And we pushed for an order that expanded to include month-to-month leases, expiring leases, and a prohibition on evictions for minor lease violations. We asked the governor to suspend late fees through the pandemic and extend a 30-day right to cure rent through the pandemic. We also knew that information about emergency rental assistance and resources for tenants wasn't necessarily getting to those who really needed it the most throughout the state. And so we've pushed for developing a resource guide and a robust information system so that we ensure that people are really getting the resources they need throughout the pandemic. We also talked about long-term interventions, including considering a statutory limit on the amount of late fees and interest that landlords could charge tenants in rental or mobile homes in the next legislative session. So if you go to the next slide, I am happy to report that since we issued our report, we've had 3 executive orders issued by Governor Polis. One was actually in the middle of our task force meetings, and that was to reiterate the CDC order and require that landlords provide the CDC guidelines and the declaration form to tenants so that they knew that they had the option to utilize that stay on evictions. And then we had 2 more executive orders when we completed our work. One that, as I said, expanded the moratorium to include month-to-month leases and expiring leases, and the evictions for minor lease violations, as well as a restriction on charging late fees for tenants, which were huge. We really felt like those were really big wins in Colorado. In the meantime, as well, our governor has found the resources to provide households who have been relying on unemployment insurance, $375 per household or per individual in a household who's drawn on unemployment during the pandemic, which of course isn't as as robust as a $600 a week payment, but at least is something that can help people cure some of their back rent or other bills. And I'm proud to say that as of today, our governor just made a public announcement today that he's proposing to put $50 million towards emergency rental assistance in 2021. We haven't determined exactly where those resources are coming from, but as part of a robust package to keep people safe and housed and continue the Colorado economy, he has put $50 million in that plan, which is great. We also really have teed up work for ourselves and our legislators in the 2021 legislative session. Some of that work involves trying to identify more financial resources for emergency rental assistance and making some of the interventions that he has put in these executive orders permanent. We really feel like we and our partners are determined to build on these wins and keep moving forward to ensure that Colorado tenants are protected.
Thank you so much, Jenny. I see a lot of interest in getting more.
Go ahead.
Oh, I see a lot of interest from folks who would love to get more information about the orders from your governor. So if you're okay with sharing that in the chat box, I think that would be great. And I do see a question about, what is the impact on some of these provisions on some of the small landlords who might also be facing some challenges?
Yeah, that's a really good question. And I'm glad when I'm done, I will put links to the executive orders as well as our report into the chat so that you can see the recommendations that came out of the task force. We Enterprise, our coalition of partners, and this task force talked a lot about the impact on landlords, especially mom and pop and small landlords. And we really don't want the burden of housing protection to fall on landlords. So one of the recommendations that was unanimous coming from both industry and from advocates and others, elected officials and others who were on this task force, was to find those resources to pay back rent. So in Colorado, we have one of our emergency rental assistance is called the Property Owner Protection Program, or POP. And that is a program that the state of Colorado has set up so that landlords can apply to fill rent for tenants who have had a COVID impact. And so actually another outcome of our task force was that the governor put $2.6 million more of COVID-19 funding into that POP program so that landlords would have that stability and be able to draw upon that fund. We, of course, the COVID-19 funds will expire at the end of the year, and we expect that all of those funds will be expended. The state will roll into using CDBG for that program in January. And I think that this $50 million that the governor has identified in this new plan is a nod towards the need for landlords to be able to backfill those rents so that they're not burdened because of circumstance.
Great. Well, thank you so much, Jenny, for joining us. If you have other resources to share, you can share them in the chat box. And thank you so much for being able to share this. I hope other states will take your lead and also reinstate or instate eviction moratoriums, since so many of them have already expired, and we know that this is an ongoing risk to renters. So thank you so much.
Thank you for having me. Appreciate it.
Now we're going to turn to our field updates. First, we're going to hear from Jesse Rabinowitz from Miriam's Kitchen in Washington, D.C.
Hey, y'all. Thank you so much for having me. It's great to be with all of y'all. Wanted to give just a little bit of background about Miriam's Kitchen. Miriam's Kitchen has worked in DC for the past 37 years to end long-term homelessness through meals, case management, supportive housing, art therapy, street outreach, and advocacy. And we're a convener of the Way Home campaign, which brings together, about 105 organizations and about 6,000 voters who know that DC can end homelessness. Like many of y'all, we have been working around the clock to ensure that our unhoused neighbors are having their immediate needs met during the COVID-19 pandemic, while also continuing to push our elected leaders to end homelessness. And I'm excited to talk about the work that we've been doing and will continue to do over the fall and winter, and wanted to just take a second and ground us in some of the key principles that we think about when we're doing this work. Those are a core belief that housing ends homelessness, an understanding that homelessness is not caused by the people experiencing it, but rather caused by systemic racism and racialized capitalism. We place an enormous importance on centering the voices of people with lived experience of housing instability. And specifically in the context of COVID-19, we're not really seeing anything new. We're just seeing things amplified, that COVID-19 is amplifying crises that have been existing for decades and centuries in our country. And we firmly believe that DC has enough money to end homelessness if we ensure that our wealthiest residents and businesses are paying their fair share, and that we have to invest in services and basic human needs like housing and things that make communities truly safe, instead of investing in things like more policing and more criminalization. So a very brief context of what's going on in DC. Well, there's been some incremental change over the past 5 years. Even before COVID-19, we were in the middle of dual housing and homelessness crises. The most recent point in time showed that nearly 7,000 households experienced homelessness. And we also know that between 40 and 70,000 households struggle to pay rent. DC has the highest intensity of gentrification in the country. And we know that nearly 88.5% of people experiencing homelessness are Black, compared to just about 48% of district residents on the whole, which reminds us that homelessness is caused by racism, and is caused by systemic oppression. And we will not be able to end homelessness until we build and create new ways of existing. And on kind of tying this back to COVID, in July, Brookings found that about 56,000 households were worried about paying rent. And even if just 12.5 of those households were to enter into homelessness, it would double DC's homeless population. So we, as I've mentioned, COVID really reminds us of the deep intersections between homelessness, healthcare, evictions, employment, racism, and other related factors. And as such, we've developed a more comprehensive advocacy platform rooted in many things that are happening at the same time and that are actively connected, right? So we know today is the second day of hypothermia season in DC. We're experiencing a third wave of COVID. There's an anticipated increase in evictions and homelessness when DC's kind of tenuous but present eviction moratorium ends. And we're also right up on a possible significant local budget cut due to the economic impacts of COVID-19 that could greatly threaten housing programs and supportive services. So that kind of leads us to what we're thinking about and what we're pushing on for the next 4 to 6 months. And those things break out into 6 buckets. Increase funding to end homelessness and stop cuts to existing funding, stop evictions, ensure DC's COVID-19 responses meet the needs of all of our unhoused neighbors, stop encampment evictions and clearings, especially in guidance with what the CDC has said, ensure adequate socially distant hypothermia resources, both during the daytime and in shelter, and lessen the time it takes to move into housing by fixing discriminatory barriers and roadblocks, both with landlords and at the housing authority. And while we know all of these areas are deeply interrelated, we did find breaking these up into discrete work groups were helpful. And we found that coordinating our work in this way has enabled us to deepen relationships and organize with those outside of the traditional homeless advocacy community, to include mutual aid groups, legal service providers, anti-eviction campaigns, environmental campaigns, health-related campaigns, and many more. And we're just feeling so energized about bringing in these voices and perspectives, and continuing to center the voices of people with lived experience of homelessness in these priorities and strategy and in this work moving forward. So thank you so much for letting me share that with y'all. And I am happy to answer any questions.
Yeah, thanks so much, Jesse. I do see a question about, what makes DC a little different is that it's in the same housing market as Maryland and Virginia. And I'm wondering if you could share a little bit about maybe if there are any efforts to coordinate responsibility in those different jurisdictions.
Yeah, that's a great question. So there's the Metropolitan Council of Governments that does our regional coordination. And that kind of happens between the DC Council and then the regional governments in our neighboring jurisdictions. and that work is being done, but it definitely can happen better. I think one of the examples I think of is DC, Maryland, and Virginia all chip in to pay for Metro, our public ridership programs, but we don't see that same level of sharing for the needs of people experiencing homelessness. So I think it does provide us with a model and something to work for.
Mm-hmm. And I'm wondering if you could share a little bit more about some of the discriminatory barriers and roadblocks at your housing authority, and maybe what some of those are and what the solutions are to that.
Certainly. So yeah, I think that's kind of two buckets. One is discriminatory barriers we see landlords employing, and one is roadblocks at the housing authority. So I know like folks in many jurisdictions see the use of exorbitant rental fees, voucher fees, criminal history checks, credit checks, eviction histories, all sorts of ways to kind of create this new form of redlining that put undue burden on people with vouchers. So we're working, and there has been legislation introduced to tackle all of those things. And then we're also just seeing some really long delays at the housing authority that have existed before COVID, but certainly seem to have gotten worse. We're seeing people, wait between 6 and 8 months between getting a voucher and getting an inspection. So at a time when we see many government systems working more efficiently than ever before to really respond to the urgent needs of COVID, we're hopeful that the housing authority in turn can modernize and kind of cut away some of that bureaucracy to really focus on getting people off the streets and out of shelters into the housing we know that will enable them to thrive.
Yeah, that's a really good point about how, this pandemic has shown even more about what some of the underlying challenges might have been, and increases a sense of urgency of trying to fix those. So I appreciate so much you joining on today's call. I don't see any other questions from attendees, so we'll keep moving on. But thank you so much for joining with us today.
Thanks for having me.
Right. And now we're going to turn to Sakina Hoyt from the city of Newark, New Jersey, who's going to share some of the work that they've been doing there.
Good afternoon. Thanks to the National Low Income Housing Coalition. Thank you all for your your amazing work, and for inviting the City of Newark's Office of Homeless Services to share a field update. So again, I'm Sakina Hoyt. I have about a month ago, very recently, been appointed the City of Newark's Homelessness Czar by the Honorable Mayor Raj J. Baraka. I direct the City of Newark's Office of Homeless Services, where our mission is to work collaboratively with stakeholders to provide the safety, well-being, and self-sufficiency of homeless persons through strengthening our homeless service delivery system, and with the ultimate goal of ending homelessness. With respect to the City of Newark's COVID-19 mitigation plan, as some of you all may know, our numbers have been increasing substantially, both in the state of New Jersey and in our city. As a result, Mayor Baraka has directed us to just go back to the basics because the strategy that he employed at the height of the pandemic worked. As a recap, early in April, Mayor Baraka admonished the administration to begin to employ an aggressive strategy to combat COVID-19. He was particularly concerned about the most vulnerable populations, which included the sheltered and unsheltered homeless, amongst various other vulnerable populations here in the city. So at the time, he requested that a homelessness task force led by the Department of Health and Community Wellness under Dr. Mark Wade, at the time focus on addressing COVID mitigation amongst the homeless. Mayor Baraka required that we beef up our outreach efforts to the homeless. This meant that our contracted outreach agencies were to increase their staffing capacity. At the time, we had one outreach agency that was contracted by the city and still is, Bridges Outreach. Additionally, the task force began aggressively recruiting volunteers to assist us with those outreach efforts. It was surprising because there were many people in the community that were just willing and able to just assist even in the midst of the pandemic. And that was really critical and helpful in the homelessness outreach. Simultaneously, the mayor required that we stand up a shelter specific to those homeless or at imminent risk of homelessness and that were directly impacted by the pandemic. ultimately, this became a hotel non-congregate shelter with a capacity of 325 individuals. In addition to this non-congregate shelter, the Department of Health and Community Wellness stood up an isolation/quarantine facility for those in the community that tested positive with COVID-19, but did not have a place to isolate or quarantine. This was a resource which proved really helpful with respect to the mitigation efforts and ramping up the outreach and having a place for our homeless community to be able to shelter should they need to when tested positive. We also connected with our shelter operators throughout the city to gauge their capacity for additional residents and place homeless individuals there when necessary. By June, we had placed more than 600 individuals in sheltering, obviously in the midst of the height of the pandemic. We issued shelter guidance based on the CDC recommendations. We met frequently with our shelter operators to discuss creative mitigation strategies, sheltering in place incentives, and proper protocols and policies to receive consumers and to properly and safely manage their safety in the midst of the pandemic. And it wasn't easy, and it's still not easy. You can't force people to shelter in place. And so the incentives have been tough. But that's something that we still continue to work with the shelter providers to kind of brainstorm around. We also embarked upon a COVID-19 testing campaign throughout all of the shelters in the city. And finally, we instituted COVID-19 weekly site visits at all the shelters in the city, both funded and those shelters that are not funded by the city. Our goal was to ensure that the shelters were following CDC guidelines and that they had familiarity with the protocol for individuals that tested positive at their facilities. And we supplied PPE to further promote their safety. And that was done through the City of Newark's Department of Health. Thankfully, through the mayor's aggressive strategies and concern for the most vulnerable, we avoided mass outbreak in our shelters. As we're currently in the second wave, we are again being aggressive in our approach to mitigate the spread in our shelters and throughout the unsheltered homeless community. In addition to what we've done and continue to do, we've requested that all the shelters update their COVID mitigation plans. We've received those plans and they are being reviewed by our consultants, which they'll also include lessons learned from the first wave. We've also requested that the shelters identify their most vulnerable residents, those with pre-existing health conditions, to ensure that we're optimally prepared for those individuals. We've also requested that they identify isolated spaces if they have the capacity in their shelters for those populations. And we'd like to proactively segregate those folks to further protect them from the viral exposure. We're working with the Department of Health to schedule COVID-19 testing within our sheltering community, but also our unsheltered community, which we did not do the first time. The first time we just focused on testing our sheltering community. And so the State Department of Health has partnered with our City Department of Health to help us to employ strategies to test those that are actually living outdoors. We will also be administering influenza vaccines at all of the shelters as well. And we had a really great discussion just 2 weeks ago with the shelter operators and the director of the Department of Health around COVID testing and flu vaccine facts and myths. And just on a final note and a high note, as a result of the pandemic, it afforded us the ability to place more than 600 folks in shelter. We've developed a citywide collaborative comprised of many agencies, mental health services, our housing authority, substance abuse treatment services, our outreach agency, and many housing providers with actual housing resources. And the goal of this group is to ensure that all that were placed in the non-congregate shelter are transitioned into housing And I am happy to report that almost 50 of the folks that are in the non-congregate shelter have been placed in permanent supportive housing to date. And we're going to continue to work aggressively to place all that were sheltered in that non-congregate setting. So that's my report. Thanks again to NLIHC. I'll put my information in the chat if you'd like to further discuss, and I'm happy to answer questions.
Thank you so much. I'm so glad to hear that you guys are focused not just on keeping people safe currently in congregate shelters or people who are unsheltered, but also looking towards that permanent housing solution. So I appreciate that. I am seeing calls from people who would love to see the city to put even more resources to housing, which I'm sure is something that we would hear a lot from people on this call in particular. And I did see that people had a question about testing, but I think you responded to that. So the only other question that I see are folks who wanted to know more about which consultants you guys are working on to review the COVID plans that were submitted by the shelters.
Oh, sure. Bloomberg and Associates.
Bloomberg, okay. Mm-hmm. And any other questions for Sakina before we move on? I don't see any other questions, but thank you so much for joining with us, and we appreciate all of your help and all of the work that you and the mayor are doing to help protect people who are experiencing homelessness during the pandemic.
Oh, thanks for having me. Thank you.
Now we'll move on to our update on what's going on in Capitol Hill. But first, I'll just mention, obviously the election is tomorrow, so go out and vote if you haven't already. And that's going to have an enormous impact on all of the work that we've been doing, not just focused on the pandemic and the response to it, but the work that we do in general. So expect to hear from us soon on what we think the election results will mean for our work. We can talk about that next week on our call. But for now, I did want to give folks an update about where things are with a relief package. So we're seeing that negotiations are continuing, and but that progress seems to have slowed down, even though Speaker Pelosi and Treasury Secretary Steven Mnuchin have been seemingly making some progress over the last week. We saw those negotiations sort of break down. There was accusations that Speaker Pelosi shared a damning letter with Mnuchin and with the press, and so things have, I think, fallen out a little bit over the last week. But even outside of those particular negotiations, we know that the House and Senate are very deeply divided over the overall cost of a relief package, and they still haven't made significant enough progress on resolving issues about state and local aid or liability protections for businesses. So there's still a lot to figure out. What we're also starting to see is more and more disagreement among Speaker Pelosi and Senate Majority Leader Mitch McConnell about timing for when a bill could be passed. So Speaker Pelosi is arguing that a relief package needs to be passed as soon as possible in the lame duck session, regardless of the outcome of the election. But Senate Majority Leader McConnell is saying, no, let's not move forward on a bill until 2021. I think we're going to see an effort by Speaker Pelosi to try to move something in the lame duck. She has said to reporters that she's willing to tie a relief package to some sort of an appropriations deal. The current continuing resolution expires in mid-December, so this is a bill that keeps the government open using last year's funding levels. So in mid-December, Congress has to either pass another continuing resolution or pass final spending bills, or else we'll see a government shutdown. So it's considered must-pass legislation. Something has to move on it before the end of the year. And I think adding a relief package to that might make it more difficult to find compromise, but hopefully that means we can see a relief package passed sometime in the next couple of months or next month or so. For now, the Senate is on recess until Monday, November 9th. The House is scheduled to return the following week. And so we will see where negotiations stand after the election, and we'll talk about that on our next call too. I'm just going to quickly to see if there are any questions that came into the chat box. Jerry is asking whether or not things will move if Democrats take over the Senate. I think either way, we're going to see that it's going to be a challenge to pass a relief package because right now, at least to get this bill through, you still need 60 votes to overcome a filibuster, which means there will have to be some combination of Democrats and Republicans voting for a final bill. But if Democrats were to control the Senate, it does mean that they'd have a lot more authority and decision-making about bringing a bill to the floor at all, which what we've seen Mitch McConnell refuse to do. So I do think that if it gets pushed to 2021, we will see a bill that will probably be one of the very first things the next Congress does. But our hope is that we can see something sooner than then so that we can make sure that resources are reaching people and communities as quickly as possible. So with that, I will end today's call. Thank you so much for joining with us today. And we look forward to talking with you next week. And hopefully by then we'll have more information about the outcome of the election so we can talk about what that means for our work ahead. So thank you so much.